and Part B coverage information right on your mobile device. You can download it for free on both the App Store and Google Play. See estimated costs of outpatient procedures. Compare national average prices for certain procedures performed in both hospital outpatient departments and ambulatory surgical centers. Visit medicare.gov/procedure-price-lookup. Get easier access to your personal Medicare information. We've improved mymedicare.gov to make it easier to find what you need. We added new features, like the ability to print an official copy of your Medicare card. We also connected mymedicare.gov to Blue Button 2.0, a secure data connection that lets you share your health information with a growing number of mobile apps, third-party applications, health-related services, and research programs. Coming soon. Easily find and compare quality information. Quality information about Medicare participating doctors, hospitals, nursing homes, dialysis facilities, and other Medicare providers will soon be able in one easy-to-use place. Will soon be available in one easy-to-use place. Compare quality ratings, cost information, and other details to help you choose what's best for you. Coming in late 2019 to medicare.gov. To stay on top of e-Medicare improvements and other important news from Medicare, sign up to get email updates at medicare.gov. Contents. Getting started is on page 4. What are the parts of Medicare is on page 5. Your Medicare options on page 6. Original Medicare versus Medicare Advantage, that's on page 7 through 8. Get the most out of Medicare, that's on page 9. Index of topics, that's on page 10. Section 1, signing up for Medicare, page 15. Section 2, find out if Medicare covers your test, service, or item. That's on page 25. Section 3, Original Medicare, page 51. Section 4, Medicare Advantage plans and other options, page 55. Section 5, Medicare Supplement Insurance, Medigap policies, that's on page 69. Section 6, Medicare Drug Coverage, Part D, that's on page 73. Section 7, Getting Help Paying Your Health and Prescription Drug Costs, that's on page 83. Section 8, Know Your Rights and Protect Yourself from Fraud, that's on page 89. Section 9, Get More Information, that's on page 101 or 101. Section 10, Definitions, that's on page 109. Section 11, Compare Health and Prescription Drug Plans in your area, that's on page 113. So what I'll do now is I'll go ahead and read some of the definitions first, because I think that would make sense. So we know what we're talking about here. Operational definitions first. Section 10, Definitions. Assignment. An agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the payment amount Medicare approves for the service and not bill you for any more than the Medicare deductible and coinsurance. Benefit period. The way that original Medicare measures your use of hospital and skilled nursing facility services, SNF services. A benefit period begins the day you're admitted as an inpatient in a hospital or SNF, skilled nursing facility. The benefit period ends when you haven't gotten any inpatient hospital care or skilled care in a SNF for 60 days in a row. That's when it begins. That's when it ends. The benefit period ends when you haven't gotten any inpatient hospital care or skilled care in a SNF for 60 days in a row. If you go into a hospital or an SNF, skilled nursing facility, after one benefit period has ended, a new benefit period begins. You must pay the inpatient hospital deductible for each benefit period. There's no limit to the number of benefit periods. Coinsurance. An amount you may be required to pay as your share of the cost for services after you pay any deductibles. I'll go over that again. Coinsurance. An amount you may be required to pay as your share of the cost for services after you pay any deductibles. Coinsurance is usually a percentage, for example, 20%. Copayment. Copayment, an amount you may be required to pay as your share of the cost for Medicare medical service or supply, like a doctor's visit, hospital outpatient visit, or prescription drug. A copayment is usually a set amount rather than a percentage. For example, you might pay $10 or $20 for a doctor's visit or prescription drug. Creditable prescription drug coverage. Prescription drug coverage, for example, from an employer or union that's expected to pay, on average, at least as much as Medicare's standard prescription drug coverage. Let me read that again. Credible prescription drug coverage. Prescription drug coverage, for example, from an employer or union that's expected to pay, on average, at least as much as Medicare's standard prescription drug coverage. People who have this kind of coverage when they become eligible for Medicare can generally keep that coverage without paying a penalty. If they decide to enroll in Medicare prescription drug coverage later. Critical Access Hospital, a small facility that provides outpatient services as well as inpatient services on a limited basis to people in rural areas. Custodial care, non-skilled personal care, like help with activities of daily living like bathing, dressing, eating, getting in or out of bed or a chair, moving around, and using the bathroom. It may include the kind of health-related care that most people do themselves, like using eye drops. In most cases, Medicare doesn't pay for custodial care. Deductible, the amount you must pay for health care or prescriptions before original Medicare, your prescription drug plan, or other insurance begins to pay. I'll go over that again. Deductible, the amount you must pay for health care or prescriptions before original Medicare, your prescription drug plan, or other insurance begins to pay. Demonstrations, special projects, sometimes called pilot programs or research studies, that test improvements in Medicare coverage, payment, and quality of care. They usually operate only for a limited time, for a specific group of people, and in specific areas. Extra help, a Medicare program to help people with limited income and resources pay Medicare prescription drug program costs like premiums, deductibles, and coinsurance. Formulary, a list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits, also called a drug list. Inpatient rehabilitation facility, a hospital or part of a hospital that provides an intensive rehabilitation program to inpatients. Limited reserve days. In original Medicare, these are additional days that Medicare will pay for when you're in a hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for a daily coinsurance. Long-term care hospital. Acute care hospitals that provide treatment for patients who stay, on average, more than 25 days. Most patients are transferred from an intensive or critical care unit. Services provided include comprehensive rehabilitation, respiratory therapy, head trauma treatment, and pain management. Medically necessary. Healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms that meet accepted standards of medicine. Medicare Advantage Plan, Part C. A type of Medicare health plan offered by a private company that contracts with Medicare. Medicare Advantage plans provide all of your Part A and Part D benefits. Part B benefits. Medicare Advantage plans include health maintenance organizations, preferred provider organizations, that is, private fee-for-service plans, special needs plans, Medicare medical savings account plans. If you're enrolled in a Medicare Advantage plan, most Medicare services are covered through the plan. Medicare services aren't paid for by Original Medicare. Most Medicare Advantage plans offer prescription drug coverage. Medicare approved amount. In Original Medicare, this is the amount a doctor or supplier that accepts assignment can be paid. It may be less than the actual amount a doctor or supplier charges. Medicare pays part of this amount, and you're responsible for the difference. That's Medicare approved amount. The next one, Medicare Health Plan. Generally, a plan covered by a private company that contracts with Medicare to provide Part A and Part B benefits to people with Medicare who enroll in the plan. Medicare health plans include all Medicare Advantage plans, Medicare cost plans, demonstration/pilot programs. That's demonstration or pilot programs. Programs of all-inclusive care for the elderly. PACE organizations are special types of Medicare health plans. PACE plans can be offered by public or private companies and provide Part D and other benefits in addition to Part A and Part B benefits. Medicare plan. Any way other than Original Medicare that you can get your Medicare health or prescription drug coverage. This term includes all Medicare health plans and Medicare prescription drug plans. Premium. The periodic payment to Medicare, an insurance company, or a health care plan for health or prescription drug coverage. Preventative services. Health care to prevent illness or detect illness at an early stage when treatment is likely to work best. For example, preventative services include Pap tests, flu shots, and screening mammograms. Primary care doctor. The doctor you see first for most health problems. He or she makes sure you get the care you need to keep you healthy. He or she also may talk with other doctors and healthcare providers about your care and refer you to them. In many Medicare Advantage plans, you must see your primary care doctor before you see any other healthcare provider. Referral. A written order from your primary care doctor for you to see a specialist or get certain Medicare medical services. In many health maintenance organizations, HMOs, you need to get a referral before you can get medical care from anyone except your primary care doctor. If you don't get a referral first, the plan may not pay for the services. Service area. A geographic area where a health insurance plan accepts members if it limits membership based on where people live. For plans that limit which doctors and hospitals you may use, it's also generally the area where you can get routine non-emergency services. The plan may disenroll you if you move out of the plan's service area. Skilled Nursing Facility, SNF care. So that's Skilled Nursing Facility care, or SNF care. Skilled nursing care and rehabilitation services provided on a daily basis in a skilled nursing facility. Examples of SNF care include physical therapy or intravenous injections that can only be given by a registered nurse or doctor. Okay, I'll go over this part as well. Section 11, before I begin reading. Compare health and prescription drug plans in your area. Plan coverage and costs can change each year. If you already have a Medicare plan, look at your plan's coverage for 2020 and compare it with other plans. If you've compared different plans and decide to stay with the plan you have, you don't have to do anything. Medicare supplement insurance, Medigap policies aren't included in this section. To find out which insurance companies sell Medigap policies in your state, visit medicare.gov. Remember, you can't use and can't be sold a Medigap policy while you're in a Medicare Advantage plan. See pages 69 through 72 for more information about Medigap. I'll read the last part again. Remember, you can't use and can't be sold a Medigap policy while you're in a Medicare Advantage plan. Important. The information in this section can help you narrow your choices, but it isn't enough for you to select a plan. See page 9 for ways to get personalized help when choosing a plan. How to read the Medicare plans chart. Plans and costs are listed by company name on the following pages. Use these descriptions to help you read the charts. If Call Plan for Details appears, Medicare didn't get the information in time to print it. Some plans may have an annual deductible that you must meet before your costs are covered. For more information, call the plans you're interested in. Number 1, service area. Area where the plan is available. You must live in a plan's service area to join. Check with the company to see if the plans you're interested in are offered in your area. I'll read that part again. Check with the company to see if the plans you're interested in are offered in your area. Number 2, monthly premium. The amount you pay each month for coverage, in addition to your Part B premium. Number 3, out-of-pocket limits. The first amount shows your limit for in-network Part A and Part B services. The second amount, if applicable, shows your limit for out-of-network Part A and Part B services. Some plans may show one combined amount which includes both in-network and out-of-network services. Number 4, primary care visit. That last one was out-of-pocket limits. Primary care visit. Amounts you pay for an office visit to a primary care doctor. 5, specialist visit. Amounts you pay for an office visit to a specialist. Number 6, chemo drugs. Amounts you pay for chemotherapy. 7, other Part B drugs. Amount you pay for Part B drugs, like injectable or infused drugs given as part of your doctor's visit. Number 8, home health care. Amount you pay each day for home health care. DME. Amount you pay for durable medical equipment, like walkers. Annual Part D deductible. amount you pay for your covered Part D drugs before your plan starts to pay. Part D drugs, range of what you pay for a 1-month supply of covered Part D prescription drugs. Number 12, offers extra benefits. Shows whether or not the plan offers extra benefits that original Medicare doesn't cover, like vision, hearing, dental, and more. Check with the plan for specific benefit information. 13. Company name and contract number. Name of the organization that contracts with Medicare and its contract number. 14. Type of Medicare plan. Shows whether the plan is a health maintenance organization, HMO, private fee-for-service, PFFS plan, preferred provider organization, PPO, medical savings account, MSA, or cost plan. See pages 61 through 64 and 67. Number 15, members' rating of plan. How plan members rated the plan from the most recent consumer assessment of healthcare providers and systems, CAHPS survey. If a plan doesn't have a rating, you'll see a note that explains why. This rating is just one of the many measures Medicare uses to give plans an overall rating between 1 and 5 stars. Visit medicare.gov/plan-compare for more information about plan quality, including the overall star rating that gives you a single summary score to make it easy for you to compare plans based on quality and performance. If a plan doesn't have a rating, you'll see a note that explains why. Number 16, plan name and ID number. Shows the different plans offered by companies that contract with Medicare. Number 17, plan phone number. Use this number to call the plan for more information. Number 18, plan website. Visit the plan's website for more information. Page 116, Medicare Advantage and other health plans in Southern Florida chart. This chart provides basic information about what your costs will be in each plan. See pages 114 and 115 for information on how to read this chart. Contact the plan for specific details and ask if it's currently accepting new members. Visit medicare.gov or call 1-800-MEDICARE, that's 1-800-663-4227 to compare plans or look for a plan that isn't listed. TTY users can call 1-877-486-2048. See Plan 9 to find out how. See page 9 to find out how to get personalized help when choosing a plan. Okay, so I'll cut this video short, and in the next video, I'll go ahead and read Section 1, signing up for Medicare. That's on page 15.